Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why. Good evening and welcome to Pause for the Truth. I am your co host, Jocelyn Turner, and our behind the scenes guy is being a little comedic tonight, showing pictures of me. But anywho, so happy to be with you all tonight as we talk about something that we don't talk about often, but many folks deal with it on a regular basis and should consider going to a chiropractor. So joining us soon, he's running a couple of minutes late, is Dr. Royce McGowan, a local chiropractor here in Northeast Florida. I remember meeting Dr. McGowan years ago when as he was starting his practice, and he's really grown it to be a very well respected practice here in Jacksonville. Of course, I can't do the podcast alone. Joining me each week is my co-host, Dr. Rogers Kane. How are you doing this evening, Dr. Kane?
I do well. I'm doing absolutely fine. I can't complain. It wasn't quite as hot as it has been in the most recent weeks. It still had a little pepper to it, so to speak, earlier today. But I'm glad to see it a little bit cooler, and I'm glad to see that we avoided the first hurricane of the season. Because early on it looked like it could come our direction. So thankfully, it will not hit anywhere on the continental United States. We might feel some of the effects from especially like with the waves and maybe a little flooding in the Carolina shores. But other than that, we'd be thankful for it. As the heat wave is what we're looking at, the bigger issue, as well as, since we're just discussing a few things, as well as we're beginning to see
Dr. Kane, before you get into that, let me acknowledge our behind the scenes guy, Tyrone Jackson, who likes to come on. He likes balance, by the way, to our audience. He likes to see balance on our screen. So he likes to pop in and then he'll cause some confusion and then pop out. But how you doing this evening, Tyrone?
I'm doing well, thank you, Miss Jocelyn. And a little late birdie told me, Miss Jocelyn, that we forgot to say happy birthday to your co-host in crime, Mr. the one and only Dr. Kane. So don't forget to tell people that he's officially an old man.
Yes. Happy birthday, Dr. Kane.
Happy birthday.
Hey, thank you, sir. But thanks to Dr. McGowan, I don't feel like an old man.
Right. How you doing, Dr. McGowan?
I'm good. That's on you, man. You young, man. You get young, the state of mind.
Well, my state of mind right now is definitely young, unlike these other two people I got on the.
Well, we're super excited to have Dr. Royce McGowan with us tonight. And Dr. McGowan, I like to get creative when I come up with the titles. And I know you can talk about all things chiropractic, but to our audience, we're going to talk about how chiropractic care supports whole body health. Dr. Kane has been such a champion and advocate for chiropractic care. And it's so funny because I have shared so much about what's been happening to me in terms of my health issues, because I like people to recognize, Dr. McGowan, that everybody deals with health issues. There are things we can do something about, and there are things we can't do something about. So hopefully, as we have the conversation tonight, people will realize there are some things that you can do about? So first of all, tell our audience a little bit about yourself, including why chiropractor of all professions. What made you choose that one, Dr. McGowan?
I get that a lot, man. And I always say the same thing. It was nothing but God, because I didn't know what I wanted to do when I was in school. I knew I wanted to be a doctor. So it was a real quick story. I was an offensive lineman in college. So I used to weigh 300, about 320, 325. And I lost a lot of weight my sophomore year. And my freshman year, I'm sorry, going into my sophomore year. So what I did was I just ate. I ate. I gained like 65, 70 pounds. But in the process, I developed a hiatal hernia as well. Eating all that food and just swallowing it and all that. I didn't know what was wrong with me because in my sophomore year, I was throwing up. And anyway, long story short, I ended up going to the hospital after my sophomore year, and they had to do an upper GI and all that stuff on me, and found out I had a hiatal hernia, and the doctor told me I had to take this medication for the rest of my life. Now, I'm cool with people taking medication if you need it and all that stuff, but even when I was young, I ain't had no medical knowledge. I was like, for the rest of my life. And then I looked up the side effects on some of that stuff, and I was like, I can't. So I did some research on my own and found out that I needed to start chewing my food. I needed to stop drinking water, soda, and all that stuff while I was eating. I needed to stop eating spicy food. I needed to stop eating after 6, 7 o'clock. So then I was like, yeah, man, I did that stuff, and I basically I fixed myself. God first, but then he helped me with the knowledge, and I fixed myself. And then I was like, man, what do I want to do? I mean, I'm going to school. I was in pre-med biology, and I was like, I don't think I want to be a medical physician now. I think I want. So anyway, I pivoted into physical therapy. So then I did an internship at now I'm finna tell my age at Methodist. Now it's shame.
I thought you were younger than that, Doc.
Yeah, I'm old, man. I could be y'all uncle. No, but I did an internship at Methodist in with Dr. Bolatiwa. He was over physical therapy at Methodist there, Shands, whatever you want to call it. And it was cool, but it wasn't me. I was like, I can't see myself doing this. And I had already got accepted in the PT program. I was gonna get my doctorate in physical therapy. I said, I can't do this. So then I never get a guy named Michael Harris. He's like my dad. He's still talk to him probably once every 2 or 3 months now. And he was like, man, you ever thought about like Tennessee State? He came by and he was like, you ever thought about being a chiropractor? I said, man, I don't even know what a chiropractor is. And he was like, man, listen, go sit with this guy. Never forget, Dr. Toddy. That's his name, on White Ridge Road in Nashville, Tennessee. He said, go sit with this guy, see if you like it, and then come back and talk to me. And I went over to that guy's office. Man, I had a ball. I said, man, this is what I want to do right here. And segueing into other stuff. I always tell kids, the kids I mentor and just kids that come in the office, I say, man, before you spend 5, 6, 7, 8, 9, 10, 20 years in school, go and sit with that profession and see if that's what you want to do first. You know what I mean? And I think there's a lot of people out here that take they got this idea in their mind what they want to do, and they go and they spend all this time and they get into school and they get out and they finish, and then they can't stand what they do. You know what I mean? So that really helped me out. That was pivotal. That's how I ended up becoming a chiropractor. I mean, I love that.
So tell me the one thing about it. What did you see, or just I'll change that. What is a chiropractor?
Well, chiropractor, we're a holistic practitioner, and my role, different chiropractors they do different things, but my role in this world basically is I treat spine pain holistically with chiropractic manipulations, which is basically putting motion into the spine, allowing motion in the segments, and allowing the body to heal itself. That's what I do basically. So go ahead. I'm sorry. No, I'm saying I deal with it.
Let me run into one of the questions that I was gonna ask, but since you brought it up, Mr. Turner prompted you to kind of discuss this. my relationship with you was from initially with a chiropractic role. Met you way back when you were just probably finishing up internship or whatever, and
Yes,
you
sir.
worked with someone else. And I'm like, man, you work for yourself. You'd be a great guy, a great chiropractor. And you took that ball and you ran with it. I mean, to heights that I didn't even imagine. At the same time. So I congratulate you on that. But one of the things that I've also realized since, I wound up coming back to see you. Um, I'm shameful to say that until I actually needed chiropractic services, I
Right.
didn't appreciate what you guys could actually do, at least especially what you could do.
Right.
Okay, until you did it to me, more or less. And it worked quite well. I went from walking like Tim Conway on Carol Burnett. So the other day I was running across the parking lot and patient stopped me. Like, Doctor, would you run across the parking lot? I said, yeah, that could have been me. Running, they're going like, wow, that's the most I see you get up and go in a long time. But thanks to what you've done for me and helped me out, I'm very appreciative and it's such a great job. But
Thank
our conversations also have included you looking at total body wellness, not just the chiropractor.
you.
And
Right.
so, what is I'm kind of looking to see what we can do in terms of the broader role of spinal health in terms of your overall wellness. What's your vision of what you see along that line?
Yeah, well, you said that you said a mouthful. It's total, and I tell my patients that when they come in, I said your back bothering me, but I'm gonna talk to you about this weight you got on you,
It,
about the mental stress you got going on. People can be in tip top shape and be eating right and be stressed out and have all kind of disease processes. We
it's
all know that. It's everything. You got to encompass everything. I think I was telling my wife the other day. I said, man, you know what? I think I do more mental health counseling in our office than I do chiropractic care. Really, just talking. And I love it. I love it. I mean, I think as physicians, I think if you're a physician, you have to encompass everything with the patient and have other physicians, like yourself. I can't deal with medications. I don't know how to deal with none of that stuff. I'm not trained in it. So having quality physicians like yourself around, and referring people to these different, medical professionals when they need it. Because I look at health as an overall. My niche is the chiropractic holistic part, but everything is needed.
right.
Everything is
You,
needed.
being that allopathic physician mindset when we come through medical school and they teach all about these drugs and this, that, and the other. And over the years, as I've gotten older, especially in the last few years, I begin to appreciate more of not so much the pharmaceutical approach to medicine, even though, as Ms. Turner said many times, that I'm a pharmacist initially, and so I can appreciate pharmacy and its ups and downs,
Right, right,
peaks and valleys, the side effects versus the good effects, and
right.
so on and so on. But I've stepped back, especially since you and I have got more connected. Like I said, in the previous, we knew about each other, but not to the level of connection that we have right now, in which I begin to appreciate the more naturalistic approach to things, a more healthy approach to things, rather than just absolutely, here's a pill, here's another pill.
Right.
I had a guy come in today, 17 different medications
Oh,
that came to me on this, and I'm supposed to do something with it. But he did have something that he did have a whole lot of chronic pain syndrome, a whole lot of back pain from an automobile accident previously.
uh,
So, I'm going, so what are you getting, what is going on with your back treatment? He's going like, I came here from a heart failure, yada, yada, yada. Like, yeah, but what's going on with your back? And what is it that you're taking these chronic meds for? And how is that being treated? And of course, these days you see a whole lot of oxycodone and opioids and stuff, in which, sometimes it's needed, but they're not approaching it from a holistic approach like you are doing. What can you tell me? What do you want to discuss in terms of spinal pain, neck pain, what approaching patients of that nature?
Well, the first thing I think I tell patients I want you out of pain. So even if you have to take medication, we're gonna take it, but we're gonna take it and it's gonna be short-lived because we're gonna fix the issue. I always like to explain to my patients that, picture, just imagine you got your foot on a dog's tail. You're stomping on the dog's tail. You got your foot placed on there, and he's barking to high heaven, and he's irritating, me and you both.
Right.
I always tell the patient, I can give you some tape, and you can tape it around his mouth, and we won't hear him no more. But have we taken care of the cause of the issue?
Nope.
Nope. My foot's still on his tail. So what we need to do is figure out how to get my foot off this dog's tail. And same thing with your back pain. We need to figure out what's causing it rather than keep feeding you pills. But you need to get that to get out of pain in the beginning. But then let's try to fix the issue. Not just keep taking the pills. When the pain come back, take the pills more. Take some more. Take some more. So I like to kind of handle it like that. And then I like, in our office, we got a lot of different stuff. Some chiropractors kind of, they don't like that. But when I got into this to help people. And if sometimes chiropractic care can't help people. So that's why you come to my office and we got, we got disc decompression. I mean, that's my number one. I love that. That's my baby. Just because of the results we get out of it. I don't have to do nothing really. It's really the table that does everything. You got herniated and bulging discs in your neck, mid back or your lower back. I put you on this machine, you're gonna be feeling good after a certain amount of time. Now, what I done learned is some people get on that machine and the first 2 or 3 visits, they could have pain for 30 years and be out of pain. And then some people, I got to put them on that machine for 65, 70, 80 visits. Everybody's body is different. Right. So there's no cookie cut. Just like you guys with medication, you give one patient a pill, they find they issues and all the blood pressure under control. You get that next person the same pill, and he got all kind of issues, and it ain't working for him, and you got to change the medications out. You know what I mean? Everybody's body different. Right. So I like to have a bunch of different modalities in our office. We got disc decompression. We got a machine called a Matrix in there. That's an electroanalgesic pain machine. It's like a TENS machine, a TENS machine on steroids. So, okay. And that helps get people out of pain, without any medications. Of course, we have all our therapies, the traction beds, the EMS, the ultrasound, all that stuff. But we have laser, we have cold laser, we have a 3B laser and a class 4 laser. We just got a knee decompression machine in there. I like to look at our office as a non-surgical approach to dealing with anything almost not anything, but anything spine-wise in your body that's dealing with pain that's in my realm. I can attempt to help. And we have pretty good results with helping people with, not having surgeries and
I'm one of them. I'm a living witness to it. I was for surgery with two disc plates being placed, a bunch of screws. I wouldn't have been able to walk through the airport without setting off all kind of alarms, even from 50 feet away, with all the hardware they were talking about putting on. But because of my experience at your office, and I'm not just saying this because you're on the program. Right. I'm saying it because, and you've seen it, I'm sending patients in to say, look, let's try this first before we jump up. I may give them some medicine temporarily, but we want a permanent fix, a better fix to this without all of it being about medication and sometimes the side effects related to that, and then sometimes we give more medications to treat the side effects related to the first set of medications we gave.
So, exactly. Yeah.
So, Dr. McGowan, I want to ask a question. We hear so much about tech neck. I think that's what I have, tech neck.
Everybody got
it. And, and I'm guilty of putting my cell phone and holding down like that, and poor posture, tech neck and poor posture. What are you seeing most often in your patients today?
Well, I wrote a book last year on posture. And, man, I believe this wholeheartedly. The number one reason, 100% of the reason why people got neck pain, back pain is posture. It's posture. And I'm going to tell you, and it's how we sit. It's technique. It's on these cell phones looking down. It's this laptop. Before the cell phones came, we had laptops. Laptops worse than cell phones because you got to look down at it and people spend hours. Yep. You got to look laptops and then, you got just poor posture, period. How we sit when we drive. how we sitting at our desk at work, looking at regular computers. People had their low screens way down. Then I'm gonna tell you the main thing, and one of the most important chapters in my book is the sleep posture. Sleep posture is why people have so much pain. And people think that, forget what people think. Stop sleeping on your side. Side is what causes so many problems. I'm telling you. Side, because you can't get right. You ball up you do this, then you're on your side, you bend on to the side, then you ball up in a circle. I always tell patients, get out of bed the same way you laying down. If you think that's good posture, then keep doing it. You ball all over. It's terrible for you. People call it out. And then stomach sleeping is even worse than that. So posture is one of the main reasons people have spine pain, and that tech neck thing is real. I had a 9-year-old in my office a couple of weeks ago, man. We took some X-rays, and he got arthritis already forming in his neck. 9 years old. That's ridiculous. But when I came in to do the consultation, he's sitting in the room like this, with his head down. And I'm telling his mom, that's his problem right there. You don't need to see me. Just take the phone from him and take his head back to his neck.
How do you tell people though, in terms of, and I know you mentioned sleep, and by the way, the last time you were on, you mentioned about the neck pillow, and I had just started that, and oh my goodness, that thing right there. But the problem is the phones and the computers. But do you talk to people about the eye level, or the where you should position? Like right now, obviously, I'm on a laptop, right? So should I have it up and be looking up like that, or should I try to get it at as straight ahead as possible?
The more you can look up at something, the more it's going to make your chest get your chest out. It's going to put you in a good posture.
Okay.
The more you're looking down, the more you're going to do this.
Yeah.
So that raise, as much as you can raise that up, raise the computer up, drop your chair. I always tell people, drop your chair down low as you can go and raise.
All right, here it goes. I'm getting ready to mess up. If I mess up, it's Dr. McGowan's fault. I'm raising my computer. Here we go. Here we go. So hopefully that's it, because that is comfortable for me.
Well, you're still in a good position, and that's what I do on mine as well. I will raise when I'm here, I started to raise when I'm in front of my computer. Now, doing the show, for whatever reason, I don't know why I'm always leaning up and listening and listening.
You look like you got bad posture, Doc.
I do.
Hold that head down there, man. Get your head back.
Let me put it this way. I did until I started there. One thing I've done is that back brace that is unrelenting, that doesn't give me a whole lot of movement, because it keeps my posture correct. My biggest thing was leaning over like this, or even sitting down in the chair with patients in the patient room, or sitting down in the chair in my office. I still have really bad posture, but now I wear it every day. Even though my back is not hurting, it helps me maintain good posture, and it caused me to lose a lot of weight at the same time, because I got full. I got full early whenever I ate something, because it was pressing on my abdomen so much. It didn't take a lot. So, look, I'm down 20-something pounds. And
there you go. You can't beat that. And listen, another good thing, strengthen your abs, man. You ain't got to do 900 sit-ups. You can do, 100, 150, 125 a couple times during the day. And then that's it. You get your abs strong and your butt muscles. We never work our butt.
Nope.
You do them little exercises that I'll show you guys another time. I'll give you like a little printout on it. But the little the little things that you see the little girls in the gym doing. Yeah, the little fire hydrants and stuff like. Man, that's good for everybody. Should do that, because it helps.
I don't even know what you're talking about. Fire hydrant. No, I don't think I've done butt exercises, Dr.
Nobody does, really. I'm telling you.
And when you get older, you lose a whole lot of butt. You got to make a lot of fat, but
you can keep your butt. You can keep your butt if you do them exercises.
Yep. Well, that's one of the things we need to post here on our website. Some of those exercises, along with the name of your book, where people can get it at.
Okay, I got you. I got you.
Yeah, definitely want to share the name of your book. And by the way, you got a comment. We had a comment posted that Dr. McGowan is great. So
Oh,
apparently you have some fans, unless you paid some people off before you
Thank
got
you. I'll
on
see y'all later.
the podcast. But Dr. Jones said Dr. McGowan is great. But it just, I think people automatically go to a medical doctor, not to say you're not a medical doctor, Dr. McGowan, but
I'm
go
not.
to get some relief from medication.
Right.
Most people don't think of going to see a chiropractor for whatever reason, right? And
Right.
sometimes it may be due to the fact that their insurance doesn't cover it. Does insurance typically cover chiropractic care, or does it vary?
It does. And in the state of Florida, people can go to chiropractors without any, they don't have to have a referral. Some insurances you have to have a referral. Some HMOs you have to see your primary care and they have to refer you. But about 90% of them you can just go to a chiropractor. And
Is that right?
yeah.
Oh, okay. I
Yeah,
didn't realize
a
that.
lot of people think that. They think they have to go in for, you know what? But I like that because I like the I like to have that. I want the physician to know what's going on with their patient, where they're
Yeah,
at. And all
that
that. So
makes
I like to
sense.
go in with the doctor, and then unless I mean, sometimes we do, and it's not a whole bunch, but I do have sometimes with it. Sometimes the doctors don't really care for chiropractic too much, and
well, yeah, but
You mentioned the.
do
I'm
when
sorry.
we
Go
do
ahead, Dr.
refer to
King.
you guys, when we do refer to chiropractor, we the one thing that by referring to you is an endorsement of what is of that individual and what they're doing. Okay, you don't just refer to a chiropractor or any other doctor because you just want to refer to somebody and get them out your hair. You refer, at least that's the way I practice medicine.
right.
You refer them because you want them to do that patient some good. And so when I usually refer, if given choices, sometimes these insurance companies don't give you choices, but
Right.
when given choices, I will choose to refer you to the same person I refer myself and my family to. Because if I can trust that individual with myself and my family especially, then I can trust it with my patients.
I appreciate that, Doc. Yeah. And I will say this, the patients that you do refer over, man, I can tell you done already talked to them about it. Because sometimes I don't even bring up decompression. I just talk to them about, okay, this is what we're gonna do first. Let's see if we can serve it. And they tell me, I don't no, that's fine. You can do that, but put me on that machine that Dr. King was telling me about. I'm like, I ain't even said that. Can you let me talk to you about it? And I say, all right.
That might not be the best thing for them. They might could use some other approach. So
Well, he's
you
still
mentioned a
evaluating.
9-year-old.
He still evaluates them for what he may be saying that, but he formulates his own opinion. He doesn't just.
Oh yeah, oh definitely. I mean, I love that because it's easy. Because listen, with decompression, I believe, like even you can ask me about that 9-year-old, Ms. I think everybody, if you don't have back pain, you should get on the machine. It can prevent you from having back pain. I know we don't think on prevention in the
Mine is
90s.
neck.
We
I
wait
have
till we
neck
get
pain.
something, and
That's even
then
better.
but this
Yeah,
thing
I have neck pain, Dr. McGowan.
I'm sorry, go ahead. I'm running my
Yeah, I
mouth.
have neck pain. But I wanted to ask you a question. You mentioned you were an athlete. Do you get many athletes coming in, former athletes coming in with issues? And I don't want you to be anti-athlete, by the way, but how do you help athletes or any other person coming from a profession who may have had some issues as a result of that profession, that they're now experiencing some issues now?
Well, my athletes, of course, especially like football players and all kind of basketball players, they got repetitive trauma, especially if they played, over 4, 5, 6, 7, 8 years, especially the college athletes and the professional ones. They got injuries that they're going to be dealing with for the rest of their life. So, I swear, but I get MRIs of all my patients. So when those athletes come in, go in, kind of figure out where their herniated discs are, bulging discs. A lot of times people come to me, it's neck pain and it's radiating into their shoulder and arm, or they got consistent headaches, or they got sciatic type pain in their back, and that's just pain in your back radiating to your butt, down your thigh. Sometimes those athletes, they come in and they don't have back pain, they just have like tingling down their legs, but it's coming from their back, or tingling in their arms, the neck and my neck is a little stiff, but my arms keep going, my hands going numb.
Feet going numb.
Yep. Feet going numb, all that stuff. So we treat them the same way. Athletes, I remember when I first got out of school, I was like, man, because I was an athlete, I'm treating all athletes, man. And then I prayed about that thing and then kind of just thought about it and was like, man, everybody got a back. I'm treating everybody, man. I'm gonna treat some athletes too. You come in my office, I'm treating everybody, man. So athletes, an athlete is an athlete. They a little beat up than a regular person. But I take that back. Not all the time. You know what? I'd rather treat an athlete than somebody been working on a desk job for 40 years with bad posture. I guarantee I do an X-ray on a football player that's been playing for 10 years in the NFL and do an X-ray of something. And I'm just talking about a neck or a lower back of an X-ray of somebody that's been doing desk work at a job with bad posture, not the right posture, looking down at the computer, laptop for 35 years. I guarantee you that office worker X-ray is gonna look a lot worse than that football player.
Wow.
And speaking of, since you mentioned that, I take care, and this is not one of those pat on the shoulder things. I take care of quite a few NFL athletes. Mm-hmm. And when they come through and they start talking about any of their pains, I refer them to Dr. McGowan. And one of the reasons I do it is because they talk about, CTE injuries, the brain injuries and stuff of that nature. But they don't, the NFL is not giving them as much attention to other physical injuries, spinal injuries that include neck, lower back, whatever it may be. They don't seem to, and I know CTE is very important. I'm not dismissing it.
Right.
But so is, upon your retirement from the NFL, I remember Dick Butkus. That's just perfect, for those guys old enough and people that understand football, not you, Miss Turner. But Dick Butkus, one of a great linebacker. By the time he passed away, he was walking with 2 canes because of these really bad knees. And Dr. McGowan, although we talked about back, he can also discuss with you about what can be done in his facility for knee pain,
yes,
or shoulder pain.
Yes.
And these NFL athletes, a lot of them the ones that come to me are complaining about this kind of pain and that kind of pain. And I seem like a genius when I refer them to Dr. McGowan and he makes it better. So I'm walking around with my genius belly at his expense.
Yeah, you're right. They all had come in with them joint issues, and a lot of them, the joints are, the decrease, whether it's in their spine, shoulder, their knee, and a lot of the stuff that we use in there. And I always get them on hyaluronic acid. That's one of the main things with my car accidents. Not car accidents. Well, car accidents too, but with my with my professional athletes, I always get them on hyaluronic acid first. Try to get them on some all natural stuff. Drinking plenty of water. You'd be amazed at how athletes, all people, but definitely athletes, and they know better. I see you with your water.
Now they want to know what hyaluronic acid does and why you recommend it.
It's an all natural supplement that basically it helps your body pull water to your cartilage where you have injuries in your cartilage. So if you have some type of it could be an old injury. Like we always use it for the spine, of course. That's what I'm always treating, basically, And I'll have somebody coming in, and we may not be working on their knee yet, and they may not have told nothing about it because they came in and their back was killing them, and I get them on that hyaluronic acid, and they'll start a week or two into it. They'll be like, "Is this helping my knee?" And I'm like, "Oh yeah, it helps everywhere. Everywhere you got cartilage, everywhere you've been, it's going to help because everywhere you've been, you have cartilage in between the joints that's cushioning those joints. So if you have an old injury, it's going to help water. And that's why I tell people when you take hyaluronic acid, you have got to drink a lot of water with it as well, because it's going to help transport that water to those areas. And it just help them heal.
Rehydrate their disc and other joint related.
Yep.
So tell me, what is it when someone comes to you? I'm going to come to you, right? I'm going to call your office and make an appointment.
Yes, ma'am.
Will you tell me to go and have or bring the copy of an X-ray or MRI or something with me, or you don't necessarily need that before the visit?
Well, we take X-rays in the office. I have an X-ray machine at the office, and we have a digital motion X-ray. And then I always refer patients out for MRI as well. And if you've had an MRI within I always say a year, but if it's a little over a year, if it's not over 2 years, I'll bring it. I always tell people to bring it on in because I want to look at all that stuff because that's really the main thing. I look at the bones, but I know mainly I know I look at a little bit of stuff with alignment when I'm looking at the X-rays, and basically our insurances make us we have to take the X-ray just to take a look at everything before, so there's no contraindications, cancer, things like that before I get in and start adjusting people. But the main thing I like to look at when I'm diagnosing a patient and I can help them the best is after I see an MRI. MRI tells me everything.
Oh, I can't stand them though. Oh Lord, I'm so claustrophobic. You just lost a patient. Like, oh, I got to have an MRI. No, thank you, Dr. McGowan. If you're just tuning in, we have Dr. Royce McGowan. A lot of you may, have mentioned to us through conversations or messaging that you get somebody on to talk about my back pain or my neck pain. Now you have the opportunity to ask questions of Dr. McGowan. And if you're here in Northeast Florida, of course, you can go to McGowan Spinal Rehabilitation Center, conveniently located in Jacksonville, Florida. And how many times do you hear someone say they're on Main Street in a town? Dr. McGowan is on Main Street. So if you don't remember anything, remember that. Very nice practice. Dr. McGowan, I want to ask you though.
Ms. Turner, before you leave that, I just want to comment on your MRI. Two things, and Dr. Jones listed one of them, the first part. That is, there are open MRIs for which you don't feel.
Yeah, they always say that. They're not open to me.
They are. They open.
Well, yeah. But also, as a primary care guy, I get a lot of patients through those MRIs by giving them something to relax them, from that phobia experience that they have. And I give it to them, and I call it I don't give up drug because by the time you take it, and when you're nice and sedated, you don't really give up. And so you're a complete MRI. And that's some other things that we sometimes do with people taking MRIs to help them get through MRIs, like putting a mirror right in front of them, where they're looking at that mirror and looking behind them and don't see the enclosed structure. You'd be surprised how you can sometimes get through these MRIs. But I digress.
The first time I had one, I wanted to get through it, right? And so I told the lady to give me a cloth to put over my face. And I had just had choir rehearsal the day before. So I sang every song we rehearsed. So I was ready on that Sunday because I was just singing some praises. So Dr. McGowan, we talked about sitting at your desk, those persons who are on the phone, but what are the most common everyday habits that silently damage spinal health?
One is the phone. We've been talking about that pretty much the whole time. You got to give yourself time on that phone and then get off of it. Or like I get on my kids and my family and all my patients, hold it up. You ain't gonna be on that phone as long when you got to hold it up and look at it like this. Hey, like this. They say, I ain't on that long. And the next thing you know, 2 hours done went by, and you looking at the, and then you doing all this.
Right.
I always say hold that phone up. So the phone, laptops, they make all kind of different. You can just go. I used to sell them in my office, but you can just go on Amazon. They sell everything. I think you can buy a baby on Amazon. But you can look. You can. They got these stands. You can just put the laptop in the stand. And then that's got you sitting up and you looking up at it and the keyboard is right here in front of you.
So I mentioned, you need to be looking up, essentially, is what you're saying. So your neck could be back stretched.
Yes. I'm gonna tell you. And I know everybody can't do it. This need to be, somebody come up with this, you'd be a multimillionaire. They probably hate you in the beginning. But if they can find a way to put these screens on the ceiling, it'd be great, but you can't have bad posture and look up at the ceiling. It's gonna make you have your chest out. We got to be made to do stuff now. Everybody want a brace or want something we got to be made. The best thing is for you to try to just get your body and your musculature used to holding you in that position. But until you do that, you want to just be putting your computer in positions where it makes you do it.
I'm walking. Does walking help? I mean, should people also the whole? I remember before they would say, put your shoulders back, and when you walk, and does that also help? And does it matter?
It does. Your ear, when you're looking at the side of someone, their ear should be. Our people watch all the time. My kids, they kind of get angry at me because that person need to come into me. Look at that joker. Tomorrow. But when you see people and they had that forward their head doing this one evening.
Yeah.
One of them things like that. Your ear, when you drop your ear, it should hit your shoulder dead in the middle. If you in good posture. Because even if your head like this, and that's where that arthritis start coming in your neck when you start doing it. And it don't take much, but years, 2 years, 5 years.
Yep.
A decade done went by, 2 decades. Yeah. And you start building up all that arthritis in there. And you can't reverse arthritis. We know this.
I think the worst thing that I got was, the worst thing I got, I'm sorry, Dr. Kane, was a recliner.
Yeah, I don't like it. They the devil.
Yeah, they're the devil. I've noticed that when I recline, I notice when I get up, OMG, versus if I sit in a regular chair.
That in the sofa. Get off of that, man. Watch TV and show and then go on about your business. Don't be
you put on that back brace, you can't sit in them because the back brace keep you from sitting like what that recliner is offering you. So again, that's why I keep that back brace on.
But it's gonna help with your neck, Dr. Kane?
Well, I mean, I'm not doing a neck brace, but that was a lower back. If you are talking about the neck brace, you were talking about the neck, and you were talking about recliner.
Yeah, I think I have tech neck. I've diagnosed myself.
Hey, look, it's all the same. It's bad for your neck and your back.
Your back.
You start feeling in your back too, messing around in recliners or them sofas, and it's both of them. They both equal.
Well, let me give you a suggestion when you mentioned about people and having, they find a way to put a screen and stuff up there. I suggest you go and, like you say, they sell everything on Amazon. Just get your top of the line projector that can project from your phone, okay, and have your you can just do stuff from your phone.
Like my TV is up here. Do you see me looking up? That's where my TV is. So I literally need to put my laptop up there instead of the TV, huh?
Exactly. or have your laptop projected on the TV.
Yeah.
So I have to ask a question. Nowadays, some folks don't think you should talk about it, but I'm sorry. That's not the case for Pause for the Truth. But in Jacksonville, where health disparities exist, how can chiropractic care be made more accessible to underserved communities?
Well, it can see one of the main things I pride myself on, and chiropractic care too, that can help. It can help people, especially with back pain and neck pain. I stay in my lane with what I do. Like I said, there's a lot of chiropractors that like to do a lot of other stuff and say that they can cure a lot of things and all that. And I'm knocking them, but I don't do that. I can take care of neck and back pain. I stay in my lane. And it can keep you off of medications, period. I'm just, and it's education. It's just people being able to come in and experience it. Had in mind open, because a lot of times people hear, I ain't going to know that. You're going to crack my back. And you're going to, I kind of hate when people say that. Yep. Crack, everybody don't want to hear that. Some people, all right with it, but then some people like, I ain't going over there, man. They the devil. They ain't, no. You get in, we're going to get in, we're going to get this stuff moving, keep you all ready. That's going to keep you healthy, And like I said, when you come into our office, we start talking to you. We talk about them disparities and all that stuff as far as what not to eat. Some our people they're not educated on eating healthy stuff. And a lot of stuff in our neighborhoods, man, it's the Popeyes, it's the churches there.
Yeah.
It's it ain't no a bunch of places you can get a salad. At least a healthy one. You know what I mean?
And mostly what we see is cholesterol roll, as I called it in the past, up on Dunn Avenue. And
everything fried.
Yeah, you see all the fried, the newest craze in our neck of the woods where we're practicing. The newest phrase, you get all these fried fish, fried seafood places.
Crab places.
Opening up. The crab places, seafood places. I got one opening up right across the street from my house. And I'm like, why did that happen? And most of the time,
Right.
regretful, they don't look like us, but that's another story.
Yeah, of course. That's a whole other conversation.
Yeah,
But I'm
but the one thing I do want to make sure we don't get past, even though you said neck and spine, you also have issue. You have treatment for knees
yes, sir.
and shoulders,
Yes,
and don't forget to mention those because they work as well.
they do. They do. We have a knee decompression table in our office, and you own it for 8 minutes, man. You just go back there and relax. We strap your leg in, and it gently pulls, and it opens and it closes real nice and smooth, and it increases the blood flow to your meniscus. Allows it to basically heal. The same thing with the decompression. It does the same thing, but it
Even
does.
if you've had a knee replacement, you still can do that.
Yep. I have patients come in and have total knee replacements and still have pain in their knee, and we get in there and put them on there, and it's fine. I put them on a little lower setting, but because we always have to be careful when somebody had surgery, whether it's your spine, knee, shoulder, whatever, and we put you on that machine, and that's it, man. We've had great results with it. So
And always get that hyaluronic acid with it.
yeah, that hyaluronic acid, that's gonna aid right along with it, along with drinking the water
Right.
and sleeping like you're supposed to. Period.
Yeah, now that's a different ball game, but that's when you get old. Sometimes they try to make sure you can, get to sleep. Now, sleep like you're supposed to, like what you said. I did not sleep on my back well when I was, a younger person because it just didn't.
Right.
My most natural position that I made my natural position was sleeping on one side versus the other, never
Right.
on the back. But part of the reason I didn't sleep on the back because I had too much back pain when I did. Now I
Right.
can sleep on my back.
Right. But see, I'm
What
gonna tell
about
you.
backpacks? School is in, Dr. McGowan, and I see kids with backpacks.
Oh yeah,
Do you
Oh,
do you have children? Parents bringing their children in as a result of having those too heavy backpacks?
they do. Like I told you, I saw that 9-year-old. That was because Technic, but we see a lot of kids in our office too, man. And it's yeah, they have and a lot of it is they have all of the backpack. And a lot of them ain't wearing the backpack correctly. They got they this big, and then they got a backpack that's this big, and they got the straps way down here, and the backpack down by their butt, and it's pulling them. It's so taking some of that mess out of their backpack for one thing, tightening up the strap so it's up, and you pulling it up, and it's up on their back, and a lot of it just education, just telling them how they got to do it, and then that's it. You know how we do. We're gonna make stuff happen. We're gonna make it work.
I advocate to parents to use the roller, roller backpack type.
That's the best thing. That's
Yeah.
the best thing. Them rolling.
So you talked about people not wanting to come to you because they have all types of myths or misconceptions about coming to see a chiropractor. I don't want him popping because you said it. That was the first thing I thought.
Mm-hmm.
Man, don't they crack your back and all of that? And so, what are some other common myths that misconceptions, if you will, that people have about seeing a chiropractor?
I saw some on the news just earlier today. It was talking about me and my wife was watching the news, and it was saying how there's a study that if you crack your neck, and it was right because it was saying if you crack your neck, it can cause spinal degeneration and all that stuff. And I was like, oh Lord, now I'm gonna catch it. I'm gonna catch hell now because I know they ain't say nothing about chiropractors, but everybody think cracking necks and backs and you think about chiropractors. But a lot of myths are just it's a lot of different myths out there. We cause arthritis. No, you don't. We don't. Now, if you're adjusting a joint with crazy force, that's why you got to go to somebody that you got to get in there and move it, but you got to be gentle with it too. It's an art form to it. It ain't just, and I will say this, I get a good amount of people that come in my office, and this happens probably a couple times a week where I'll get somebody that comes in that their brother or their friend has seen a chiropractor adjust somebody and they done tried it on it, now they into me because they done got injured, basically. So don't when y'all go to these chiropractors out, don't just go and try this stuff. It's people have been trained for a while. It look easy, but don't just be going and taking somebody's neck and turning it.
So I like what you said though, in terms of making people feel when someone first comes to you, you sit down and have a conversation with them and do you find that that's helpful so that they won't be so nervous about the experience because of those things that they've heard about chiropractic care?
That's the first thing we do. We break the walls down, and I let them know, man. And we listen to people first of all. I think that's a bad thing with just physicians all the way across the board: chiropractors, medical doctors, physical therapists. They just don't listen to the patient, and you got to listen to them. And if a person is feeling like I don't force nobody to do nothing, I tell my patients, "You the best doctor. You're a better doctor than me. It's your body." So I mean, hey, I think good physicians educate you on what we have some knowledge. We educate you on what we know, and we try to instill it on you. And then hey, we're here to help you out, but you're gonna make these decisions. I make decisions along with my patients. I don't just bark orders at them.
It's a dual decision process.
Yeah, because they got to be held accountable too.
Yeah, we discussed what it is. I'm not just talking from my viewpoint, but I've noticed that being your patient, it's the same thing that you do. But we discuss what's going on. Mm-hmm. In other words, we identify the problem. Okay, right. We identify possible solutions, but then we discuss what we want to do and agree on what we want to do.
Exactly, you're right. And side note, I know I've had, and I it happen all the time, but I get that patients that come in and they come in, but then they don't want to listen to nothing you say.
No, I don't believe that.
Then they come in and them be the patients I love everybody. I'd be like, man, will you just go somewhere else, please?
Yeah, you need to go somewhere else.
I don't ever tell them that, but I'd be like, God. And
you want to say it, right?
Look, then they want to complain, man, I just ain't getting no better. You ain't done. And I said, you won't let me do. You like to argue your point, Ms. Turner. You'll come in like I know some patients. You need to let me adjust your neck. Your issues coming from they don't have no contraindications. They need an adjustment, but they just don't want their neck cracked. But their neck killing them. And I know if I give them an adjustment, they're gonna feel some little clicking and popping, but they're gonna feel 100 times better.
Oh, haven't you seen me? Mine bothers me. I will be coming to see you soon. So what's one piece of advice you wish everyone understood about maintaining a healthy spine?
Sleep on your back. That alone, I'm telling you.
With or without a pillow?
Down from God.
Huh? With or without a pillow?
Either one of them. It don't matter. Whichever one you and you can sleep without a pillow. And I'm gonna tell you, I don't care if you get no sleep. I ain't go to your sleep doctor for that. I just need you to lay on your back. Your spine I care about your spine. That's gonna help your spine heal. I remember when COVID first hit, man, and we had people, man, that was scared to death to come out the door and all. I had to do a bunch of phone consultations, and a lot of people just getting better with just sleeping on their back. Mm-hmm. And they finally got out. I adjusted them, and it was getting out to move around, and they wasn't scared to be around people. But just talking to people and making them sleep on their back got them 75-80% there.
Period. The one thing I will say about sleeping on my back that I did have to do, because Dr. McGowan treated my lower back pain. I've had neck issues in the past, but that was not the most prominent issue at the time when I first seen it. But going into getting the spinal decompression for the lower back, one of the things that they will help is prop your neck up and give you the proper support for your neck while you're on the machine. What that did is I went on Amazon, again, I go back to Amazon, like what he said, and found a pillow that gave me the same type of neck support that machine did while I was looking at my lower back, but it supported my neck. And it made all the difference in the world. I was thinking that I might have to go to him for my neck treatment, because it was beginning to be an issue with numbness, tingling, running down the arms, yada, yada, yada. But because of what that taught me, I was just being observant. Because of what that taught me in terms of supporting my neck, when I bought the right pillow, no longer got an issue with my neck.
No, that's it.
Yeah, my problem, and the other problem with some folks like me, okay, I'm talking about me, Dr. McGowan, is although I sleep with a neck pillow, I still sleep with two other pillows underneath me. And I know having, being probably too propped up also doesn't help. But somebody just wrote a thing, sleeping on your back is challenging, but it does make a tremendous difference. Using pillows to prop up your legs while on your back also help. Miss Shelton, that's me. I also elevate my leg, and that was a habit because of before I had my knee surgeries.
Hey, and thank you, Miss Shelton, for that, because that's what I keep saying: sleep on your back, sleep on your back, sleep on your back. That's the other thing. You gotta put pillows under your knees because that will take the pressure off your lower back. And everybody's different. Like I got 3 pillows. I fight my wife if she take them pillows and put them somewhere. She know that those my 3 pillows. If I don't have them 3 pillows, I ain't gonna sleep right. So
Right.
everybody different. Some people need 1 pillow, they need 2, 3. Some I might need 4 or 5, but you need to put them pillows on your back. And the way you gauge it is when you wake up in the morning, you should feel like you know, you should feel your age or younger. You shouldn't feel like you 933.
Yeah.
Yeah.
And another beneficial factor to put those pillows on your leg, quite frankly, from a different medical standpoint, those people that get edema in their feet and legs throughout the day, when they lay back on their back and and elevate their legs, it helps some of that fluid build up in their lower legs. I know this is not chiropractic, but I just want to throw it out there.
Right.
That you get a benefit from putting those pillows under your leg. Those ladies that have complained about their swollen ankles, that really help with those. Not to mention, I'm just trying to make sure that heart failure and other stuff is not an issue, uh, because when they go down like that, yeah, they can help us point. It can point toward certain things that we may need to discover from a medical standpoint, as far as edema and circulation is concerned.
Right.
Dr. McGowan, what role does, if at all, does chiropractors, or what role do chiropractors play in helping reduce reliance on opioids or pain management?
Getting them taking what that's the main thing. Then I gave you that analogy about putting your foot on a barking dog's tail. You
Mm-hmm.
can put tape around his mouth. Just think of opioids as putting tape around his mouth. And then
Mm.
if I keep my foot on his tail, he gonna bust through the tape, and you gonna have to put some more tape around his mouth. If I keep it on there, his foot getting, his tail getting injured more and more. He really want to bark louder and louder. We give you some more tape. You gonna tape it around. You got to tape it a little tougher now. And he going, you know what I mean? You got to keep doing it, keep doing it. That's what we try to do, or what we do as chiropractors, is take our foot off a barking dog's tail. We find the issue that's going on. If your pain is coming from vertebrae are moved are out of place in your back, or you got a herniated disc, putting direct pressure on the nerve, you can take opioid to the cows come home. That's not gonna fix that. It don't make you not feel it and make you feel loopy, and maybe you'll be able to function a little bit. And I always tell people this: God put pain in our body for a reason. We can't, we so smart, we blocking that it's telling you to sit your behind down. You can't, something ain't right.
Yeah.
So
Yeah.
smart. Give me that stuff. And now you taking this stuff. The issue ain't fixed, and now
Mm-hmm.
you out there doing stuff you ain't got no, because you don't feel it. You really
Mm-hmm.
injure yourself worse.
And that's what Miss Shelton just commented on. Opioids just mask the problem.
That's it.
Okay, and man, it gives me some relief. I'm not saying don't use opioid when it is
Necessary.
necessary,
Right.
but
Yeah.
it is not a permanent. It's not a solution.
Yeah. It's
It's
not.
just a temporary assistance in terms of you try to get past a certain point. You want a
Dr.
more,
Kane, you need to sit up.
And we
you want a more, you want to. I think what happened is I think I'm talking to a speaker like it's down here. The happen is that you sit back and thinking that because you no longer feel pain, what you need is to keep taking opioids.
Yep.
But what you need to make sure of is that, so what's causing this pain and how can I eliminate the cause of the pain?
Mm-hmm.
That's
Mm-hmm.
right.
Just eliminate the pain. I've seen
Mm-hmm.
patients coming out of nursing homes that were losing weight, and the family thought that they were more or less had some strokes and dementia and stuff of that nature. But when you got them away from those opioids that they were given in those nursing homes, they became the patient or the person that they were previous to getting into the nursing home. It wasn't about dementia. It wasn't about a stroke. It was about uh, that patient taking a drug that just completely nullified their decision making capability, their thought processes, and so on and so on. So if you can find a way where the patient can maintain, which is what we're looking at with chiropractic practices, can eliminate those pains without all the time taking, mind-numbing medications, then
Right.
that's the best way to go. I got one last question before Ms. Turner gets her last one in, hers in, because we're getting close to the end of the time. So, given the if a person is kind of nervous about seeing the chiropractor at the first visit, what actually the better one I want to see is how does chiropractic fit into the future of holistic and preventive medicine? I know we talked about preventive health. I know we talked about preventive health before, but with AI and everything that's coming into, the picture of the future of medicine,
Right.
I don't see a AI fixing my back. But again,
I
what
think
do
we
you,
safe. I think we
see
safe
that?
as chiropractors.
Where do you see that?
Yeah, I think we safe as chiropractors. But I do. I think more people are being enlightened. I think if you dealing with AI, people just. I think people's eyes are being opened a lot, man. People are wanting to be more healthy. And there's no knock to medical doctors at all. Love you
Nope.
guys to death. We need you. But when you look at those medications, when you look at those commercials, because they kind of dominate the airways. If you don't see Eddie Farrell or Morgan on TV, you see a drug commercial. And 75 to 80% of that commercial is them telling you how the drug gonna kill you. Or not kill you, but all them side effects it's gonna have on you.
Mm-hmm.
Right.
I think people are just kind of tired of that, at least for a long term. Like we said, if we can get in the mindset of I need to take this right now till I get myself together. I'm gonna keep eating neck bones and rice and fried chicken right now. So I need to take this right now. But the goal is maybe if I kick back and maybe eat a fruit every now and then, eat some vegetables and maybe exercise a little bit, I can get off of some of this high blood pressure, or you know what I mean? I can't speak on that, but I'm just saying, and just same thing with the pain. Instead of me just taking these pain medications, let me go see a chiropractor. Let me see an acupuncturist. Let me go to my medical doctor and get this right now. I got to work and I got to do some stuff right now. But let me, in the long run,
look
that's
for
how
alternatives.
think.
Look for alternatives to just medication.
Yeah.
Yes.
I think the future people's minds are opening up more to that. And it's I think more and more people are coming to chiropractic.
As they say, a mind is a terrible thing to waste.
Yeah, Dr. McGowan, I'm talking like this, so when I start having conversation with people, and they're like, "Why is she looking that way instead of at me?" But we're at the end of the show, seriously, and this has been very interesting. And one of our viewers said she's a work in progress, but she's gonna work on her posture and sleeping on her back. And I appreciate, Ms. Shelton, your feedback. But Dr. McGowan, as we end the show, what are your final thoughts to our listeners?
Well, just take care of yourself, man. I love my folks, man. That's why I fuss at y'all so much, man. But I won't, and it's like you said earlier, both of us, we was talking on here, all of us, man. And it ain't just about back pain, neck pain, shoulder pain, the stuff we talking about here. We really talking about whole body health, from your mental to what you putting in your body, really what you put. I want my folk to really start looking at what they putting in their body, because I tell people, look at your plate. Your food is your fuel, but it's also your medicine. You're gonna enjoy some stuff too, but man, look at your plate. How is this helping my body? How is it helping my body heal? How is it helping me with my energy level? How is it gonna help me get through the day? So I look at your food, look at your choices that you're making with your health. Take time to think about it, because we'll take time to think about all kind of stuff. Our car, we'll put time, thought in. I always use that analogy with my patients. You'll go get that oil change, when that little stick up there, ain't no black smoke coming out of the hood, and the tires ball, and the truck moves sliding all over 95. You go look at that little sticker, you go take it in. But with our bodies, boy, the engine done broke down. It's blood everywhere, and we. Then we go get it checked out. So I want people to be more preventative and start really being proactive with going to the gym, drinking water, sleeping on your back for spine health, eating what you're supposed to eat. You can have a cheap meal or two a week, but eat like you're supposed to, 90% of the time. And then, relax. Mental health is huge, man. Take care of yourself. Go to the beach, man. Get your mental health therapist. Our people frown. That's a whole nother show. But we frown on mental health, and mental health is huge. Man, my wife, she's a trauma coach. So she helps patients out all the time, man, talking to people about stuff and getting stuff off their mind. And it's funny how people no matter what's going on, man, you can talk to somebody about something. It's just, you feel me. You feel better. So just everybody looking at your whole health in a whole 360, everything, not just one thing. That's what I would like to leave everybody.
Can you touch on real quick for folks who are like, I'm going to be taking a road trip soon. Can you share some advice as far as long road trips for folks in terms of making sure that they are protecting their spinal health?
Take breaks, sit up in the car, don't be leaning back, sit in the car, bring that seat all the way up, push that lumbar cushion. Everybody got them unless you got like a 1985 car. Everything I think after like 2000, everything after like 2004 or something got a lumbar thing in it. So push that lumbar cushion all the way out in your back, and then take breaks. Stop before it starts hurting. If you notice your back starting to get stiff after about an hour and a half of driving, then every hour and 15 minutes you need to be pulling at a rest stop, get out the car, walk around, go pee, get back in the car, and then go about your business. Or you can sit in the car and I'm gonna muscle. I'm gonna go and make it these 6 hours, and then ain't nobody gonna want to be around you when you get wherever you at.
I wear my brace every time I go do that driving. I wear that brace of mine because it helps my lumbar support.
That brace too. That pressure is gonna help a ton. So that's another good thing. I still want you to get out the car and move some, but you can do it a lot longer with that.
There's other reasons to get out the car as well. Including lower extremity circulation, prevention of blood clots, blah 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 blah.
Right.
But and lower the risk of edema in the lower extremities. But as far as my back is concerned, oh no, I don't want to ride down the road without my brace, my back brace.
Right.
Because I feel it as soon as I put that first leg out the car, I begin to feel it. Yep. So it's best if I wear that brace, no issue. One last thing I'm gonna say is that just like you said, what your foods are and how they represent you, and so don't forget foods can be poison as well. So people think about what you eat and what you put into your body.
Please.
Well, thank you, Dr. McGowan, for breaking down the connection between spinal health and whole body wellness. What I love about today's conversation is that the reminder that taking care of your spine isn't just about relieving back pain. It's about improving mobility, reducing stress, and supporting our overall health. For our listeners, remember, small, consistent steps like better posture, movement breaks, and stress management can make a big difference in how you feel every day. Prevention isn't complicated. It's about paying attention to the simple habits that keep our bodies strong and resilient. We encourage you to share today's episode with a friend or family member who might benefit, and be sure to follow us for more conversations that empower you to take charge of your health. This is Pause for the Truth. Thanks for tuning in, and until next time, keep taking care of yourself from the inside out.
We appreciate you spending time with us on Pause for the Truth. Ms. Jocelyn Turner and Dr. Rogers Kane are grateful for your support. Don't forget to like us on Facebook, catch us live on Twitch, and most importantly, subscribe on YouTube. A big shout out to Tyrone Jackson at Call Tyrone IT Services for keeping us connected. Join us every Tuesday at 6:30 p.m. Eastern Standard Time for more enlightening discussions. Thanks, and see you next week.